Hello and welcome back. So, this is a video for the Naga Samurai about a trauma kit for the hood, basically. If you have no money and you want to put together a trauma kit of sorts, which you can keep it, at your house or whatever. Put it in your bag, okay? I will show you a homemade option. We talked about this a little bit in his comment section. So I thought I would do a video explaining what I had in mind when I was talking about these different things. So we have our victim here, okay? He has been into he's been into a bad situation here, and he has been stabbed and shot a few times. So we need to help him, okay? He needs medical attention or he will die. So, to treat our friend here, we have a few different items. 2 Ziploc bags, 2 pairs of gloves, trash bag, scissors, a arbitrary stick, a shoelace or piece of string, 2 homemade triangular bandages, and some duct tape, okay? So, let's start with the chest injury, okay? He has been stabbed somewhere between the navel and the neck, and there is a hole. If the item is still standing there, if the knife is still standing in his chest, do not remove the knife. Try to just stabilize it with the bandages. If the knife has been pulled out, we want to prevent air being sucked in. So what you do, first of all, you put on your gloves, protection. So then you place your Ziploc bag over the hole, and then you tape it shut, all 4 corners, with your duct tape. Okay? This is to prevent air coming into the chest. There might be an exit wound if the person has been shot. You do the same on the other side. The person might develop something called a tension pneumothorax, when there is pressure in the chest which is not getting out. Too much air has been sucked into the chest cavity. What you can do is you release the bag and try to see if some air will escape. This is called burping the wound. If that doesn't work, you can try to unclog the wound by putting your finger through the hole to remove whatever is blocking the air from escaping. Okay? If the person is not breathing due to a drug overdose or drowning, you might need to do mouth to mouth. A pair of gloves can work as a CPR barrier. What you do is you cut a slit in a finger with your scissors, and then you put the glove into the person's mouth, and you blow into the hand part which you stretch out over his face. This will give you somewhat of a one-way valve to prevent you from getting whatever he might have. So, continuing on, if our friend here has been stabbed in the groin, armpit, or upper neck area, we can use a technique called packing. You take your homemade triangular bandage, okay? This is made from an old towel. Just make sure, if you make it yourself, to boil it so it's clean. You take it and you pack it into the wound to the point of bleeding, and then you keep stuffing it until you can't stuff anymore into the wound. If this is a big cut from let's say a kitchen knife or a machete or something, you will need to fill a lot in there to keep pressure on the point of bleeding. If you just put it on top, you might not stop the bleeding properly, and this being in the wound will soak up the blood and help promote clotting. Okay? You use this if it's squirting blood. Okay? If there's not really a lot of bleeding, you don't need to do this, but if it's squirting fresh blood, you need to do it, okay? Then, if our friend here is squirting blood from the extremities, the legs or the arms, squirting blood, if it's just bleeding slowly, you don't need to do this, but if it's squirting, you need to put a tourniquet on it. Where to place the tourniquet? Well, you can put it as close to the bleeding as you feel comfortable with, 10 inches if you can, okay? The blood vessels might retract after being severed, so you want to give yourself some room. You do not always need to put it high and tight if somebody is missing the hand. You can put it, give yourself a 7 to 10 inches up the extremity and then place your tourniquet. Do not place it over joints. Place it above or below the joints, okay? So what you can use is your homemade triangular bandage. I have done a video on improvised tourniquets. You place it around the extremity, you tie one knot, like so. Then you use your stick, it can be a screwdriver, it can be whatever, with some string, shoelace, whatever. You place it in there, you tie a second knot over it, and then you twist. And then you twist until the bleeding has stopped. Once bleeding has stopped and you have twisted enough, you use your shoelace or string to secure your stick to that person's leg so it doesn't just unravel again, okay? And then, finally, we have some items here. The scissors, of course, can be used to modify the glove. It can also be used to expose the wound. You want to see what you're dealing with, so scissors. Everybody has some scissors, so you have scissors. And then trash bag, okay? Simple black trash bag. This is for treating shock and preventing hypothermia. If our friend here, he is outside on the curb, he has been stabbed, okay? You have stopped the bleeding, apply the tourniquet, pack the wound, put the chest seal on him, okay? And it's raining. Even if it's warm, he can be hypothermic from the rain. It will really cool him down, okay? So you place your trash bag over the person to prevent him from getting even colder than he needs to be. I would also recommend to put some clothing. If his clothing have been cut off and blood soaked, put your clothing on him, then dry clothing, of course, and then you can place a trash bag over him to prevent him getting wet, okay? So that's my hood trauma kit. I hope somebody will find this useful. Thanks for watching. Bye.